With more than 30 states seeing increases in daily coronavirus cases, more governors are putting the brakes on reopening. At least 16 states have either paused or rolled back their plans for reopening. And California is shutting down bars that don't serve food in several counties, and that includes Los Angeles County. In Arizona, the governor ordered the closure of bars, gyms, movie theaters, and water parks for the next 30 days.
Arizona has the highest rate of positive tests in the country, ahead of Florida and Nevada. Nearly 24% of the tests there have come back positive. That's compared to just 7% nationally over the last 7 days. According to the World Health Organization, the rate should be at 5% over 2 weeks before states decide to reopen.
Boy, the numbers are not good. Our Dr. Jon LaPook joins us now from Vermont to sort this all out for us. Jon LaPook, listen, Secretary Azar says the window is closing to get a grip on this. It sounds so ominous. What exactly does he mean?
Well, you know, in order to get things under control, you have to do two main things. And one is to find people who are infected and their contacts and to isolate them. And the other thing is to have everybody in America doing everything possible to stop from spreading it. Well, in terms of finding people, we still are not doing enough testing in enough places, so we're not doing a good enough job there. And you see people walking around not doing social distancing, not wearing face masks. So we're not doing enough, and it's still popping up all over the place.
People still are having a hard time getting the message about the testing. Why is the testing so crucial?
You have to know where the enemy is. You know, this is a war. And in a war, what do? You do reconnaissance. So you have to know where the enemy is. And unfortunately here, a lot of the people who are infected don't have any symptoms and they're spreading it. So you're relying on this spreading to say, where do we concentrate our efforts? I mean, right now we're seeing community spread. So we're seeing it pop up, the virus pop up all over the place. But it's kind of like whack-a-mole. But imagine, Gail, whack-a-mole, but the mole is invisible. In order to see where the danger is, you have to do the testing because people don't have symptoms.
And it's still that ongoing question, John, to mask or not to mask. You know, that is now turned into such a political issue, but really it's a health issue.
It's absolutely a health issue. It should not be politicized. And a friend of mine had an analogy. He said, you know, it's World War II, say, and it's the Blitzkrieg, and London is being bombed at night. And what did they do? They told people to black out their windows so that the buildings couldn't be seen. Well, imagine if there was one person who said, nah, I'm going to keep the lights on in my building. Well, the bombs might not hit your building, but they might hit the building next door. So you're killing potentially not only yourself, but people around you. And we have to have that kind of community type of thinking where we're helping not just ourselves, but our neighbors.
This is one of those cases where, listen, we pride ourselves in USA being number one, being number one. We don't want to be number one on this. What are the other countries doing that we're not? Say in South Korea, in Singapore, in Taiwan. They seem to have figured this out, and we have not.
Yeah, it's very discouraging. You know, I'm a very optimistic person, and I'm just scratching my head. Why can't we do this? You're exactly right. I'll do my little air graphics. You see in Europe, the cases going up and down. You see in Taiwan, in Singapore, in South Korea, in New Zealand, up and down. And they're able to control it because they really jumped on top of this. They isolated people. They did a lot of testing, and isolation works. The other thing they did is, you know, they had an easier time of wearing these masks. Remember, in 2003, there was the SARS outbreak. And so especially in Asia, people are used to, it's part of the culture to wear the mask. It's not felt to be a political statement. It's a health issue, just as you say.
John, help us understand this. They say we might have to go back into lockdown, but isn't it inevitable that when you come out of lockdown, there's going to be a spike in cases?
I don't think it is inevitable. And I think that's what people have to get through their head is that it's in their benefit. It's to their own personal benefit to do everything. You could come out of lockdown tomorrow, and if every single solitary person in the United States wore a mask, which has been shown to decrease spread, did social distancing, and we looked at the buildings, we made the buildings safer, we improved the ventilation, maybe we put UV filters inside to kill virus and the ducts, things like that. We could start to go back and resume our economy and resume our lives in a way that I think is a lot safer. We're seeing this in Europe. We're seeing this in other parts of the world. We should be able to do it too. It's very dramatic to see. I wish every single person could see this video of people just speaking. They say, just talking or even or singing or talking loudly, and you see the little particles coming out of their mouth. And then they put a mask on, a simple washcloth even, and it dramatically goes down. It makes a difference to do these public health measures.
I saw that video. Thank you, John. With 4th of July coming up, not a good idea to go to a crowded beach. Thank you so much.